Good morning. This is Bisi Ademuyewa again. I'm a medical oncologist and I work with patients who have breast cancer. I practice in a large tertiary academic institution in St. Louis. This is the second in my series talking about breast cancer with a goal to educate the lay public. So this series, again, none of these videos is designed to replace the physician-patient relationship. So please seek medical attention and opinion if you have been diagnosed with breast cancer or you have a mass or suspicion for breast cancer. So the first myth is when I hear from my patients occasionally is I think I'm too young to get breast cancer. This cannot be true. I'm only 20, in my 20s, I'm in my 30s or in my 40s. While it is true that breast cancer is a disease of older women, again, the median age is right around 62 years old, there are some forms of breast cancer, particularly the aggressive forms of breast cancer, that can be seen in younger women. And that's why major organizations such as the American Cancer Society recommend starting screening mammograms at the age of 40. The next myth that we hear commonly is that breast cancer doesn't run in my family, so I don't think I'm at risk. It is true that there are familial genetic syndromes that predispose certain families to develop breast or ovarian cancers. Unfortunately, this represents just under 10% of breast cancers. So most breast cancers are seen in women who do not have a familial history or a genetic predisposition. The other issue which is commonly raised is that patients tell me that I feel well, I don't have any symptoms, I don't have any pain. How can I have cancer? Majority of the time, particularly with early stage breast cancer, there are absolutely no symptoms other than perhaps a breast lump, even if that is present. The commonest scenario is that patients go for their routine screening mammograms and are found to have an abnormality on imaging, get a biopsy, and then are told that they have breast cancer. Cancer in the breast, 99% of the time, really doesn't cause any symptoms. When patients have symptoms from breast cancer, most of the time that represents a distant spread. So for instance, if a patient has, a chronic cough, that could signify that perhaps there are metastases in the lungs. If there is a bone pain, which is unusual and out of the ordinary, daily pains that we all have, that could represent a bone metastases. If there is unintentional weight loss, nausea, vomiting, that could signify liver metastases. But the garden variety, routine, early stage breast cancer really causes absolutely no symptoms. The next misconception is that all breast lumps are cancer. Again, that's not true. There are multiple things that can cause breast lumps that are not cancer at all. There is something called a fibroadenoma, commonly called the breast mouse, which is seen usually in younger women that has no malignant potential usually. There are cysts, there could be infections. There are a myriad of things that could happen in the breast that cause breast lumps that are not breast cancer. However, of course, if you have a lump, it needs to be checked out. Another misconception is that, I've been told that I have breast cancer, therefore I'm going to die. This is absolutely not true. Again, majority of breast cancers are diagnosed early, stages 1, 2, or 3, and those are fully curable with proper treatment. There are a subset of patients with stage 4 metastatic breast cancer, probably less than 5%, that are also able to achieve long-term remissions. So with proper treatment for breast cancer, most patients are living a full, productive life these days. The next misconception is for patients who already have been diagnosed with breast cancer is, seeking non-traditional care, such as high-dose vitamin C infusions, caffeine enemas for detoxification. We've heard of patients going to different countries to, go and do hyperbaric oxygen chambers. In general, those things really do not help women with breast cancer. Sugar makes it worse. Again, that is not true, but all things in moderation. There are lots of negative things about having lots of sugar in your diet, but per se, it doesn't make breast cancer itself worse. Witchcraft. Somebody in my village or in my mother's village is doing me harm. Absolutely not true. Breast cancer is contagious. Breast cancer is not contagious. Cancer in general is not contagious. Treatments for cancer, chemotherapy is not contagious. There are a lot of, men, women, particularly husbands, who accompany their wives to clinic and ask me if they can have physical relations with their wives while undergoing chemotherapy. Absolutely. There's nothing contagious about chemotherapy or other breast cancer treatments. Breast cancer is a shame. I have breast cancer. I'm going to hide it because it's a shame. The same way that diabetes, hypertension, depression, bronchitis are not shameful diseases, cancer also is not a shameful disease. Mammograms cause breast cancer, or mammograms can prevent breast cancer. Not true. Mammograms do not cause breast cancer. The amount of radiation in a mammogram is exceedingly small, not enough to cause breast cancer. Mammograms also do not prevent breast cancer. They just aid us in diagnosing breast cancer at early stages when it's most curable. I'm a man, I cannot get breast cancer. Again, not true. Breast cancer occurs in men. It's rare. About 2,500 to 2,500 men are diagnosed in the United States every year with breast cancer versus 250,000 women. So breast cancer can be seen in men, and there are risk factors. So, if you're a man and you have a breast lump, again, it's not necessarily breast cancer, but it definitely needs to be checked out, particularly if you have certain risk factors. Breast cancer has been diagnosed. I need to get it out immediately with surgery. Sometimes your doctor may recommend certain treatments before surgery, such as anti-estrogen treatments or chemotherapy. Those are being done more and more prior to definitive surgery now. So surgery may not always be the best first-line treatment for patients with breast cancer. If I have surgery and the breast cancer is exposed to air, it's going to spread all over my body. That is not true. That's an old wives' tale. If the breast cancer is not removed surgically, that is when it eventually spreads to other parts of the body. Cutting cancer out or undergoing surgery for cancer, exposing it to the air does not cause spread of cancer. Deodorants, hair dyes can cause cancer. There's no scientific evidence to link deodorants with aluminum products in them, or hair dyes or underwired bras to the development of cancer. So these are just a few of the misconceptions that people have. Again, the good thing about breast cancer, while it's not pleasant to have a cancer diagnosis, is that most people are fully cured from breast cancer with proper multimodality treatments. Thank you for listening. Again, this is Bisia Demoewa.